Mental health has become one of the most talked about subjects in recent years. It's an area that transcends cultural, geographic, and social boundaries. Despite this universality, mental health is still met with stigmas, misconceptions, and challenges in seeking support. With increasing awareness, people are starting to recognize the importance of mental well-being. Conversations about mental health are no longer hidden behind closed doors. In this video, we'll talk about mental health. Before that, subscribe to our channel Life is Often and hit the bell icon for regular updates. Let's begin. Mental health at its core involves our emotional, psychological, and social well-being. It influences how we think, feel, and act. It also plays a role in determining how we handle stress, relate to others, and make decisions. While everyone experiences periods of stress, sadness, or anxiety, mental health conditions go beyond these common feelings, affecting the way people function in their daily lives. Anxiety disorders, depression, bipolar disorder, and schizophrenia are just a few examples of mental illnesses that impact millions of people worldwide. One of the major challenges in addressing mental health is the stigma that still surrounds it. For many years, people with mental health issues were often viewed as weak or incapable of dealing with life's struggles. This stigmatization has led to silence, shame, and a lack of treatment for those who need it most. This stigma is particularly prevalent in certain cultures and communities where mental health problems are seen as taboo or as a source of family dishonor. Even now, despite greater awareness, people often hesitate to seek help due to the fear of judgment or discrimination. This societal barrier exacerbates the problem, preventing individuals from accessing the care they need to manage their mental health effectively. A common misconception is that mental health problems are rare or only affect a small number of people. However, according to global health data, approximately 1 in 4 people will experience a mental health disorder at some point in their lives. That means mental health issues are just as common as physical health concerns like diabetes or heart disease. The difference, unfortunately, is that mental health disorders often remain hidden. While physical ailments may be more visible and socially acceptable to discuss, mental health struggles are frequently kept secret, making it harder to identify and treat. Another challenge in addressing mental health is the misunderstanding of its causes. Mental health disorders are often perceived as being the result of personal weakness or character flaws, but this couldn't be further from the truth. Mental illness can arise from a complex interplay of genetic, biological, environmental, and psychological factors. Neurotransmitter imbalances in the brain, traumatic childhood experiences, chronic stress, or even prolonged exposure to violence or poverty can contribute to the onset of mental health conditions. Some people may be more predisposed to developing mental health conditions due to their family history, while others may experience mental health issues triggered by traumatic life events, chronic stress, or imbalances in brain chemistry. Mental health also affects physical health in profound ways. Studies show that people with untreated mental health issues are more likely to experience physical illnesses such as heart disease or diabetes, and they often have a shorter life expectancy compared to those without mental health conditions. This is partly due to the toll that chronic stress and anxiety can take on the body, leading to inflammation, a weakened immune system, and other physiological changes. Additionally, those struggling with mental illness may be less likely to engage in health-promoting behaviors such as regular exercise, a balanced diet, or avoiding harmful substances like alcohol or drugs. Recognizing the importance of mental health and taking steps to protect and promote it can lead to a better quality of life for individuals and communities as a whole. One of the first steps in this direction is to normalize conversations about mental health. By discussing mental health openly, we can help dismantle the stigmas that surround it, making it easier for people to seek support when they need it. Schools, workplaces, and social institutions should foster environments where mental health is prioritized and resources are available for those struggling with mental health issues. Seeking help for mental health challenges is not a sign of weakness, but of strength. Whether through therapy, medication, or a combination of approaches, treatment is available and effective for many mental health conditions, such as counseling or psychiatric care, can provide individuals with the tools to manage their conditions, cope with stress, and lead fulfilling lives. For those who may be hesitant to seek help, reaching out to a trusted friend or family member can be a first step toward healing. Self-care is also a crucial component of maintaining good mental health. This can include practices like mindfulness, regular exercise, maintaining a balanced diet, and ensuring enough sleep. Mindfulness practices such as meditation or deep breathing help reduce stress and improve emotional regulation. While physical exercise has been shown to boost mood and reduce symptoms of anxiety and depression, engaging in activities that bring joy and fulfillment, whether it's spending time with loved ones, pursuing hobbies, or simply taking time to relax, can also significantly improve mental well-being. However, self-care doesn't always mean solitude. Social connections play a vital role in supporting mental health. Human beings are inherently social creatures, and maintaining meaningful relationships is essential for emotional well-being. Loneliness and isolation can exacerbate mental health problems, while a strong support network can provide emotional comfort, encouragement, and perspective during difficult times. Whether it's a close-knit group of friends, family members, or a community of like-minded individuals, having people to lean on in times of stress can make a world of difference. It is also important to recognize that mental health is a spectrum. Not everyone will experience a diagnosable mental health condition, but everyone has moments where their mental health may falter. Just as we visit a doctor for regular physical checkups, it is equally important to check in on our mental health. If you're feeling overwhelmed, stressed, or emotionally unbalanced, it's essential to recognize these feelings and address them. Sometimes a simple lifestyle change or taking a break from daily stresses can make a significant difference. Other times, more structured support may be necessary. Ultimately, mental health is something that touches all aspects of our lives, influencing everything from our relationships to our productivity to our overall sense of happiness. By acknowledging the importance of mental health and promoting a culture of understanding and support, we can help ensure that more people are able to live fulfilling, balanced lives. The journey toward better mental health is not a linear one, and setbacks are a natural part of the process. The key is to remain persistent in seeking support, caring for oneself, and building an environment where mental health is valued as much as physical health. The research surrounding mental health has come a long way, but there is still work to be done. As we continue to break down barriers and remove stigmas, we pave the way for a more compassionate and supportive society. By caring for our mental well-being, we not only improve our own lives, but also contribute to a healthier, more empathetic world for everyone. Mental health is not a destination, but a lifelong journey, one that deserves our attention, care, and respect. That's all for today's video. I hope you liked the video. Subscribe and hit the bell icon for more updates. Thanks for watching.